Hello, thank you for taking the time to listen to this video. How to establish your professional fees can be quite complex, and many doctors out there don't take it seriously. It's quite amazing. There are ways to establish your fees so that you can get paid appropriately. Always amazes me when a client joins and I ask them, how long have they had those fees? And they say, well, for the last 5 years, 10 years, 15 years. Have they ever been changed? Nope. Have you ever reviewed them? No. Do you know what you're doing? Well, it's just the way it's been. I'm okay with it. That is not the right approach. There are ways to fix a fee schedule. There are ways to take care of these things and do it properly. A fee schedule is sometimes referred to as a charge master, and is certainly the most single important financial tool within your practice. It's not just fees. It's important of that. As with any other business, the fees charged reflect the value of the service delivered. When you strip away the clinical component of a medical practice, it's really, in reality, just another business. If you think about that. I don't want to minimize it, certainly don't want to speak negatively about healthcare, because it is, after all, what a doctor does. But it is a business. And like any other business, a medical practice must deal with expenses, employees, taxes, just about every other business-related issues. So it is critical to pay close attention to your fee schedule. Now, practices use a broad array of methods to determine their fee schedule. As I mentioned earlier at the beginning, some don't even know how. They just use them. I believe that doctors should subscribe to a philosophy of independence, and that your decision should be based on a sound economic and market-driven principle, not to be held hostage to the payors. You should know what you're doing and should be conscientious about what you're getting paid and should demand it. Therefore, it's important, as I see it, to define what constitutes a practice fee schedule. How do we get there? But truthfully, for the sake of this limited presentation, it may be actually easier to define what a fee schedule is not. Let me explain. A fee schedule is not simply a database that assigns a charge to each procedure of service delivered by a physician. No. Also, a fee schedule is not a knee-jerk reactionary instrument that is used to validate the amount of a payer will pay at any time with you to be reasonable. Not the way it works. A fee schedule is a concise tool to give patients, payers, and regulators and reviewers a clear picture of how every practice defines the value of its service. It's a well-developed and maintained fee schedule that sends a signal that the practice itself is market-sensitive and fiscally responsible. Note these terms because I say them carefully. Market-sensitive and fiscally responsible. Knowing that what you've done is according to your area for the service you render and the way that you're supposed to do it. Fiscally responsible according to all of the other type of services that are rendered nationally. Let's talk about something called a conversion factor. A conversion factor is a value used to convert some units of measurements into a charge. For example, if you were to take a car, let's say, to a shop, and I hope you're not being offended by the fact that I'm giving an example outside of the healthcare field, but I want you to get the point. If you take your car to a shop for repair, you will normally get an estimate of the repair cost, right? That makes sense. And that's done by taking the average number of hours it would take for a certified mechanic to fix the problem, and then they multiply this by an hourly rate. So, for our own purpose in healthcare, in your clinic, for instance, the conversion factor is a per unit value that is multiplied by the RVU, which is relative value units, to convert it into a fee or charge for a service of the procedure. That's what this is. Now, there are three primary methods that I'm going to cover here today. Again, remember, this is limited to just a video, so it's not a full area of information, but enough for you to be able to start doing the research. There are three methods, primary methods in this case, to calculate the central conversion factor for any group of codes, whichever one you want to choose. One is called the average, which is recognized as the least accurate. Another one is the median, which is more accurate, and then the weighted average, which is in this case known to be the most accurate because it factors in the frequency for the codes, meaning the number of times the code is reported. Now, let me briefly speak about benchmarking fees as well, because that's important also to understand. It's a standard by which, in this case, something can be measured or judged. There's a summary, which is called and you may or may not have heard of it, I'm not sure, but this is important to know. It's called the Physician Supplier Procedure Summary Master File. I know it's a long term, but that's what it is. Sometimes you'll read it and it's called the PSMF. You may have seen that or not. I do a lot of research, obviously, because of all of our clinics, and we are quite involved. Our clinics are quite large and extremely, extremely successful. We have to make sure that we're on top of everything else. Now, this summary, this Physician Supplier Procedure Summary Master File, the PSMF, contains 100% of all the claims submitted to Medicare during a calendar year. This database, believe it or not, contains something like 5 billion claims, and it represents every billable procedure code performed by nearly every physician in the USA. So you can see why this thing is huge, but it's important. And because the majority of practices submit their reasonable charges to Medicare, this PSMF it's an excellent data source on how they determine the average charge levels by national and state aggregate for each procedure code, and also by specialty. For the purpose, however, because I want to make sure that you don't get too confused or this information is not blowing you away, for the purpose of this limited presentation about a fee schedule, and as a summary to give you some idea, a primary goal of you as a doctor, and that is for your practice to be profitable, you have to make sure that a proper fee schedule has been developed and that your practice should remember to routinely check it every single year, and then measure the fee schedule by performance. And the way you can measure it is against the EOBs and the other validation data. And this isn't something that you could just forget about, or something that you could say, well, I'm not sure I want to do that. This isn't something that works like that. This is something that's important to your practice, something that is critical to the growth and the survival of your practice. Many doctors I find out there are not collecting what they're supposed to. They don't know. Well, I set up this fee and I did 3 times Medicare value. Oh, I did 4 times because I thought it was what my friend was doing. That's not reasonable. This is not the way to do that. There are many ways that you can do this professionally. I know that with our doctors, we take every precautionary measures to make sure that things are done appropriately. And you should do so. You should make sure that you do it that way so that you earn what you're supposed to earn, what you deserve to earn at the highest level in the most ethical and legal way. As always, I wish you all the best in everything that you do. And I look forward to hearing great news, amazing news, above and beyond everything that you do. Let's make it happen because you deserve it. And I appreciate you. Thank you. Please subscribe to my YouTube channel and click the notification bell to get my latest updates.